Assalamu alaikum, the communication day. First scenario, Mr. Jack, 52 years old, admitted after extensive intracerebral hemorrhage. He was put on mechanical ventilation. Treating team made the decision that he has brainstem death and to start withdrawal cessation of the ventilation in the best interest of the patient condition. Your task is to talk with his son, Mr. John. You ready, Dr. Maida?
Yeah.
Okay.
Hello, my name is Dr. Maida, one of the medical doctors. Can I confirm that you are Mr. John, son of Mr. Jack?
Yes, I am.
Okay. Hi, Mr. John. Yeah, you are the next of kin for your father, yeah?
Yes.
Okay. Okay, Mr. John, thank you for coming. I'd like to talk with you about your father's condition. Is that okay? Is that okay to talk now?
Yes, okay, doctor.
Okay. So before anything, can you tell me how far you know about your father's condition?
My father is suffering for hypertension for a long time, and about 1 week back, he has severe headache and he become unconscious. We bring him to the hospital here, and the doctors saw him and he admit him to the CCU, to the ICU, and they connect him to the breathing machine. This is what I know about him.
Mhm, mhm. I highly appreciate your knowledge about it. Mr. John, I'm very sorry to tell you that your father has suffered very large brain hemorrhage. It was very large one. And despite all efforts, this has caused severe damage to his brain stem.
What is brainstem, doctor?
Okay, so brainstem is the part of the brain that controls basic life function, like breathing and everything. Uh, our our tests have shown that sadly your father had died as a result of this injury.
But I see, I can see his lungs is increasing and decreasing, and the monitor also showing there is a rhythm of the heart and the blood pressure is maintained. How you feel he is dead now?
Mm. Um, I know this is hard to understand and hard to say, but in medical term, we call this is brain stem death, which means that he has permanently lost all brain function and there is no chance of recovery.
You are sure, doctor? You did some tests, some investigation to make sure that his brainstem is already damaged or
Mm.
died?
Yeah, as we put him in the machine, you saw your father now in the machine. This is machine uh, help his breathing and also to keep him looks like alive. But we did investigation. This including imaging to his brain, and we found that the main part of the brain, that's what we call the brain stem, is actually died. And if we remove the support from him, he will not recover by himself. And what keep him looks like alive is the machine. How this sound to you?
Okay, doctor. Okay, this is very bad news for me, really. I expected this doctor can evacuate this blood from his skull and to save his life. I think they delayed to take this evacuation for the blood to make him alive. Why you don't consult the surgical team to evacuate this blood before it compresses the brain and damage it?
Mhm. Uh, okay, I highly appreciate that. However, in your father case, evacuation of the blood from his brain is not a it wasn't a one of the options we had, and the brain damage already has happened, and the main part of the brain that's responsible about the life function is already died, and he will not benefit from having a surgery in his case. And we believe that continuing life support is no longer helping your father. And the medical team has made a decision in line with national guidelines that it would be appropriate to begin the process of stopping life support, and this is called withdrawal of treatment.
Oh, doctor, how's that? You don't enough for you to delay to evacuate the blood. You also wanted to disconnect the machine, breathing machine from him. How much?
I know this is a lot of information for you, and it is really sad and hard to be absorbed altogether. And in your case, I think it's very hard to understand, but this is what's happened. And your father brain already has been died, and giving support. Supporting him with machine will not add anything to his condition, and he will not benefit from that. That's why we decide of the withdrawal of the treatment. This is by after discussion with our medical team, and as I told you before, surgery is not one of the option in your father case. So there is no delay in evacuation of the blood, as I said, because the blood's inside the brain. Normally, we didn't evacuate that if it is inside the tissue of the brain. You understand me?
Yes, I understand, doctor.
I want to reassuring you that this decision has been made very carefully, and it is in your father's best of interest, as he's has already died from a brain function perspective. This is not about giving up on him. It is about allowing natural process to happen with dignity.
Okay, doctor. It is very hard news for me today, but what I will do, nothing to do.
I understand how incredibly difficult this is. We are here for you, our team, including specialist nurse, chaplains, is available to support you through this, through every step.
Thank you, doctor.
Also, we have a counselors as well. All this team will be helpful for you.
Thank you, doctor. I appreciate this.
Okay, so as I understand, there is a lot of to take. Do you have any question or any more concern?
I wanted to finish this papers quickly to take the body. As long as once you disconnect the machines from him to take the body quickly, because many work I wanted to finish.
Mhm. Okay.
2 minutes left.
Okay. After we stop the machine, and then we'll let the nature take its process, and your father will function will be decreased gradually, and then he go in deep sleep and dies in peacefully. At that time, we can give you the body, and we try to help you uh, to help you in this process as well. As I told you, always our team is here to help you and supporting the family as well. If you have any more concern, Mr. John.
Okay, may I ask my older brother to come to have a look before disconnect the machines?
Yeah, absolutely, absolutely. Any one of the family, before we stop the treatment completely, they are allowed to come to see him and say goodbye before before we stop the treatment, and this is allowed, and we are happy to help in that part as well.
Okay, doctor. Okay, doctor. Thank you. Thank you, doctor. I appreciate your help.
Yeah, thank you. Still there's. Do you have any more concerns?
No.
Okay. Just beforehand, if your father has anything in particular regarding his body, if he need to he put any ideas about organ donation or anything?
No.
Is he?
No.
Okay.
He did not put.
Okay.
Okay, time is up.
Thank you. Yeah.
You want to add some minutes?
No.
Okay.
Minutes.
Well done. Let's hear the comment, Dr. Mahi, then I will comment.
My comment is only, Dr. Mayada, you have task here, hidden agenda, that organ donation. You just remember it at the end. So you should early, after you finish addressing this or giving this data about this patient is already technically died and irreversible damage to the brainstem, and he is considered died now. You should ask him, your father have any living wish, any lasting power of attorney, any advance directive? If he said yes or no, no problem, then you will go to the next step about organ donation. And recently I hear from one mentor that even the patient is not putting him for organ donation card or any so this patient is fit for organ donation. Even he did not sign any card or anything, because in NHS now in UK, they do some website about organ donation, and all people should in the population should apply for it, either yes or no. And the one who say no, they will not take from him. And the one who say yes, and the one who did not apply in this website, both of them are included in the organ donation. So this patient should be, even he has no card and he has no applying in the website, so he is now fit for organ donation to take the vital organ, because we have much list of patients about need for end stage failure of organs and the need for this. So you should ask him first, your father have any living wish? He has any, what about his thoughts regarding helping others for end stage organ failure? Then you talk to him about this. And I think also you forget or not forget, time is short to take any social help, anyone dependent on your father like this for any help. Okay. But otherwise you do well. Okay.
Yeah, thank you, Dr. Mahi.
Thank you, sir.
Let's have a deal that Dr. Maida did well. Okay, she did in a comprehensive way, confident. But yeah, yeah, I like the way Dr. Maida talking. Really, she is very convincing one and very confident. But the missed point here, which is the hidden agenda, yeah, it might harm the marks, but supposed to learn from this scenario, the lesson here. Any brainstem death scenario, you have to talk about organ donation. And the way Dr. Muhi mentioned is very nice. What about your father thoughts helping other people when he was alive? She will tell you, yes, doctor, he wished to help others, he wished to share with others in committees, charities, anything. If you have this idea or initial approval about, not approval, thoughts about her father or his father, it can give you a clue that she might accept the idea of organ donation. So you will proceed further. Some surrogates, they will tell you, no, doctor, please don't do anything for his body. You will not argue with them. You will just refer them to the organ donation team. But if the idea is accepted by the father and the son, you can speak sometimes about organ donation. So he might help many patients waiting for kidneys or liver. They are suffering a lot. And by this, your father will have a lot of hours and he will help them by helping these people. They are suffering a lot. This is the way how to convince. But let's start from the beginning. Dr. Maida, you can invite someone here, right? You are going to break very bad news. So you need anyone to attend this meeting with us.
I feel
What?
this.
Yeah.
This time, but I feel like okay.
Yeah, you feel like the time is up already. We
Already
passed.
we passed.
Yeah,
So
it's okay. Next time. This is the most important point in this scenario initially, I mean, in the introduction. Do you want anyone to attend with you this meeting? Why? Because I'm going to break very bad news. So what's so far you know about your father? As he mentioned, what's your expectation? He will tell you he will be fine or he will be okay, anything. I think this is the most indicated scenario to do breaking bad news, warning shot, and golden silence, right? Death, nothing more extreme than the death, right? So you can tell him, in our way of breaking bad news, I'm so sorry, I don't have good news for you today. Oh, wait, what happened, doctor? Is his brain improve? Anything happen? Is he in coma? He will expect something away from brain stem death. But you will break this after the golden silence. So I don't have good news for you today. What happened, doctor? Tell me. Pause and start to say, your father has been diagnosed with what's called brain stem death. Again, another silence. Then ask him, have you ever heard about it? Doctor, what you mean? What is this? Is it death? Is my father dead already? Because you mentioned death, but it's not clinical or body death. It's brain stem death. Now you the time to explain as you did, Dr. Maida. So the brain stem death happen whenever there is damage to the brain. The tissue will be damaged by either bleeding, not hemorrhage. In UK, I believe sometimes they are accepting these jargons. But again, we are talking in general, bleeding, not hemorrhage. In your blood, in your father brain has been damaged the remaining or the rest of his brain. Unfortunately, the brain tissue has or have no, it's not able or the tissue not able to regenerate again or to be alive if already has been damaged. That's why we did a lot of tests, investigation, image, everything showed or showing that your father brainstem is not functioning more. And unfortunately, this brainstem is responsible about most of the organ function, including the breathing, the heartbeat. And once we remove the machines, your father breathing will stop, the heartbeat as well will stop. Of course, you have to give pauses after every sentence. Are you following me? Understanding me? But I'm saying it as explanation. Okay, it's clear now. After that, as Dr. Mohi said, I have another news. What about your father wishes or thoughts about helping others when he was alive? And continue explaining what already mentioned initially. Clear? I think this is the main idea of the scenario. And it's good scenario, by the way. It's hidden agenda, yes, but it's straightforward scenario. Breaking bad news, explaining the condition, brainstem death, and hidden agenda organ donation. At the end, you have to support or you have to offer support. Do you need any support? Any social support? My father, my son, sorry, my brother want to come. Okay, absolutely yes. We can try to postpone this, but after approval of the organ donation team. You are not going to disconnect these machines unless they refused the idea. But if they accepted the idea, so you will arrange a meeting with the organ donation team, and they will keep patient ventilated, supported if they agreed for donation. And after that, they can take him to the operation theater, and during the harvesting the organs, after that they will disconnect. They will give the body to the sons, and they will continue the death certificate. Uh, the other point Dr. Mohi already mentioned, in UK, not only in UK, even in Gulf, in the license process, they are offering the option of organ donation. Are you accepted this organ donation, or are you candidate for organ donation or no? And in HS, everybody living in UK considered as or labeled as organ donor unless he's rejecting, as Dr. Mahi said. That's why they want to activate this issue in the population. Any doubt or debate about this scenario? About what I mentioned? Who's the yes?
Really,
Yes, Dr.
really,
Mahi.
Dr. Bassem, I heard Dr. Hussam in the last session. He said about this organ donation, don't include in your scenario, except if he mentioned it directly in the scenario outside. Because you will deliver the brain stem death, it is already bad news, and you will have time to here really Dr. Mohi making like he didn't like making the surprise or the denial or something to drama, but in real scenario you will find some drama. He will ask more
Yeah.
and like that. He said organ donation, if he tell you directly, if he need to mention it, he will write for. If because in real life, they didn't mention in the same meeting about brain stem death, it is bad news. So they will invite the family, they will reassure first, and they will see their relative first to say, then they will discuss this with specific team, maybe. If he tell you that you should discuss this, yes, okay, you will discuss. And as Dr. Mahi said, now it is, if no, it is mean it is yes. If no any card of no organ donation, it means that it is all, except if some only he mentioned some exception, like any diseases or below 20 or 1 year only in UK, like some rules there. But he said in the last thing, he said, if they didn't mention to you the organ donation by name, don't speak about, because it will conflict the end of the scenario. And as he said, yani, it will not good or wise things to mention in this scenario.
My respect, Dr. Aisha, to any mentor, but I disagree about this idea, because never ever the organ donation will be clear task. It would be a hidden agenda one. This is my opinion, and that's why we are trying to publish this idea. Whenever we have brain stem, particularly brain stem, not ICH, brain stem scenario equal organ donation. This is my opinion again, and I believe this is supposed to happen in the exam. I don't know if anyone has doubt. He can also raise it. We can do open discussion. But before that, please, Dr. Maida, write the scenario for Dr. Mahi to prepare himself. Okay. Anyone has doubt about or suggestion? Who's
Yes,
agree?
we
Who's
need
disagree?
another opinion.
Yeah.
Or we can ask another mentor also.
No need. I don't. The mentors are not examiners. So even the examiners in the exam, they have different judgment.
The problem, Dr. Bassam, that they have, if they are having a lot of candidates, they knowing what is the feedback, what is the one lead in the exam. So this is give them
Perfect. If he has evidence and he show it to you or to the candidate during the session, it's okay. We will believe on that. But if he doesn't have and he just trying to explain, my respect, it's I think it's not applicable. So the only thing you can comment on if you have solid evidence like feedback about this issue. Otherwise, I will not accept. Okay, someone wrote here, agreed with Dr. Bassem. Dr. Salah also preferred organ donation with the stem death. See, it's again, it's mentor individual opinion. Some mentors will say yes, do. Others will not advise. So they are not Quran.
yes, I know.
Exactly.
I mentioned what
Yes,
I
I know
hear
you are
recently. Yeah.
trying, but yeah, the people will be having conflicts, either yes or no. But for me, or especially the brain stem death, you have to speak about organ donation. It's not the time to get a consent. Just give him idea.
It's depend on the in the scenario and the patient in front of you. If like the patient is accepted and the patient is okay and everything, and it's easier to pass this news to the patient, I will pass it to him. But I pass this news in fact to this patient because at the time I have still a time to give. But if the patient is shocked and it's not easy for the patient, I will monitor this
Yes,
and
this
I will
is what
see.
is I
I
said.
will not
If
say
it is a
I
lot
will
of
not say
drama
it
and the patient already
Yes,
shocked from the
yeah,
news,
yeah.
it's
it is
according
very
to the
hard to.
scenario.
Okay, I
Mm.
agree. If
Not
you
like
don't
a
do,
rules. It's about who is who. You feel the scenario, how it looks like, how that patient reacts, how he's accepting the news. If he accepting the news easily and everything is smooth and I can pass it through, I will pass it through. But if not, I will stop here. And
okay,
I think no one will decrease my mark. It's communication. It's a way how to sense about the people in front of you. It's
yes,
not
it's.
about roles,
I agree with
solid
Dr.
roles.
Maida. You will try your best, but maybe the scenario and the situation will not allow you to explain more. He will be shocked, he will be shouting, he will be angry. So you will feel like I cannot pass another bad news. It's okay, that time you cannot talk about it. But if he's calm, like our surrogate in this scenario, I guess you can give it even for 1 minute as a briefly. This is my opinion again. But please don't
And
forget.
also in Wani's book and in Rider, they write organ donation these scenarios. So this the problem that before they think it should be in all scenarios of brain stem death.
I agree. It's a must. You have to do it if you have time. If you
In
have
yes,
good surrogate.
in Wani's book and in Rider. But as Dr. Maeda said, it is really according to the situation.
Yes, you will try to do it. Okay. Put in your mind that I should do the organ donation explanation. But when you go inside, you might have angry daughter or son, and he will shout at you all over the scenario. You will not be able to explain it. Okay, that time you will be having excuse, but otherwise you have to do. You got it? So let's
Yeah.
depend on the situation.
Okay, Dr. Basim, imagine Dr. Basim, this patient was shouting at the first of the scenario.
Yeah,
Then
you have to avoid.
at the end, he become calm
Okay,
and
at the end they become calm. Now you can share the idea, as Dr. Maida did at the end, even with the one sentence. There is what's called organ donation. What do you think about your father's thoughts? Did he help others? Yes, he had. Okay, we can arrange a meeting with our organ donation team to sit with you to explain more about this idea.
The
Till
problem,
that
Dr.
time.
Bassem, this situation is not easy as that.
Okay,
The
at
next of
least
kin is the
It
next
is
of
a
kin
part
has
of
the right
conflict
to
always.
agree or
No.
refuse?
sorry.
Is the next of kin he has a right to agree or
No, no, no. It's
Yes,
It's
the
not.
relative, they have right to refuse.
They
Yes,
have
they have the right
they
to
have the
refuse.
right. Yeah.
But if the patient himself, for example, wrote a paper
Yes,
or chart,
if
yeah,
he
you will
mentions
try
that,
to
yes,
convince. You will
yes,
try to
yes.
convince. Some patients they have tattoo over the chest. Don't resuscitate me, or I am a donor, organ donor. So you can do it as a document, okay?
Mhm. Mm.
But his approval only as complementary for the documents. So we'll try to convince. If not, the organ donation team will convince. If not, another team organ donation meeting to convince. Specifically, if the patient himself write in his document or advance directive. But if he refused, the patient, for example, refused by document, by any document that I will not be donating my organ, yeah, it's not the time to talk about, and you
The
can
problem
post.
also, Dr. Bassam, that because what I convinced with this point, he said, what do you know about the patient to decide if he is applicable for organ donation or no? Maybe the patient have chronic disease. Maybe
Okay,
he is in
they will
having
write that. They will write
um,
that he is not candidate, for example, or he has comorbidity, diabetes, in this
yes,
stage.
this is why if I think I don't know if you mention organ donation and he already having chronic diseases or
If
what is the
mentioned, you cannot do, but if not mentioned, you can proceed. If
he
mentioned,
is already old age like that and they have already
he's not
hypertension,
old.
have
He's 50s.
No, 52 is not old.
I
Why?
don't know the
Yeah,
age,
50s,
but I
50s.
suppose that if he having hypertension and having problems, so if they didn't mention that he is candidate for organ donation, how we can make sure this point is applicable for this patient?
Okay, if they wrote, for example, or if they didn't write that the patient is free, medically free, just he have or he has hypertension lead to bleeding or ICH, that time you can do the organ donation explanation. But for example, in the comorbidity of the patient, for example, in the stage renal disease on hemodialysis, he's suffering a lot and he has COPD, a chest infection. I think he will not be able to donate anything. Okay, that time you cannot talk about it. But in this scenario, they didn't mention if he has any comorbidity. So why not? He can be donating. Dr. Aisha, please try to make it related in every scenario with organ donation for brain stem death to speak about organ donation, unless you have something. So by default, organ donation for brain stem or brain stem, you have to talk about organ donation. Anything happen or something in the scenario or the angry son, all this situation will let you know that this is not the time to talk about organ donation. You got it?
Yes, yes,
Yeah,
yes, you're
but
right.
by default, make it as a rule. Whenever I have brain
Yes,
stem,
we can
I
write
will,
in our paper and according to the scenario
yes, and
pass with
according to the
you,
scenario,
yeah,
yes.
and the reaction
Especially,
of the
especially brain stem, not
relatives.
ICH, massive comatose patient. No, only brain stem death. Okay,
Mhm.
make it as a clear brain
Yes,
stem death only, because whenever they mention in the scenario brain stem means he's for organ donation. But if they said patient have coma and ICH massive that doesn't be suitable for surgery, no, it's not the time to talk about organ donation. He might have some responses in the brain stem. He's not
mhm.
clinical brain death, but any brain stem death patient means he's a candidate for organ donation. Okay.
Yes.
Okay,
Mhm.
good also to have this debate because whenever we have conflict, always it clarify the things. As the doctor wrote in the chat box, Dr. Salah said, yes, you have to talk. But other mentor said, no, you don't have to talk. But we don't have clear evidence. If someone explained this scenario before, or he has this scenario in his exam and he has the feedback as an evidence, please share with us to be clear and sure we should or we shouldn't do it. Okay. I think also with the video, some listener can share in the video, for example, or They can message in the group that we have this in exam. I experienced this scenario in my exam, and they wrote for me this or that. So I hope it will. I'm talking now for the future. Anyone will hear this video and he hear about this scenario in his exam, please share with us in the WhatsApp group to be more sure and confident about our talk. Thank you, Dr. Aisha. Let's move to the next scenario. Dr. Maida, did you share the scenario
Yes, I've shared in the group.
in the WhatsApp?
Yeah.
Okay. Dr. Mahi, did you see the scenario? Because
No.
I will share it and I will read the comments. Mr. Brad present to the hospital with weakness diagnosed as motor neuron disease. Please discuss with him diagnosis and management plan. Very nice scenario. Motor neuron disease, Dr. Mahi. Explanation and a management plan. Okay, the comments. Hidden agenda, Dr. Mawadda Salah. Hidden agenda must be brainstem with organ donation. And if angry, you can tell him if you want time to discuss. Excellent idea. With family, we can arrange another meeting. Great idea. Also nowadays in KSA, same, we discuss brainstem with organ donation. Perfect. So she is supporting the idea. In Rider, Dr. Hatem, in scenario, brainstem, they speak about donation. So he is agreed. Dr. Salah, I already read the scenario, agreed. Yeah, Dr. Hatem mentioned so polite and quiet son. Yes, I agree with this also. Also, okay. Anyone has comments, doubts? Dr. Mahi, 2 minutes or 1 minute, then we can start. Just the highlights of explanation of the disease and see what are the concerns. Waiting for you. If you're ready, let me know.
Yes, sir. Okay, sir.
Let's tell about the organ donation. If he tell you it will delay the funeral or it will disfigure his body. So we can mention that we have a clever teams that he will close the wound probably, and they also make this donation in rapid way to not delay any funeral arrangement. Also, I think here in this scenario, we can talk about the bereavement team and spiritual support. We can offer anyone to drive you home. I think this also points we should mention here.
Yeah, perfect. Yes. We should speak about support, the bereavement team, and spiritual support. And as you
And
said,
about
for
organ donation, we
closing
can
the cuts.
encourage, yes,
Yeah.
about that many people waiting for organs, and already these organs will decompose
exactly.
after this. And
Yes.
if your father or your whatever is the relative is a kind one and have honor to like to be kind to people, I think it will be appropriate that to let him in after his life also having this kind behavior.
Yes, sure. This is what we mentioned earlier. Yes. So you can use it as a weapon if your father helping people while he was alive. So even in his grave, he's helping others to survive long time with his organs in this way. Yeah, you're right. And regarding the cuts, yeah, we have professional and expert team. They did this many surgery many times, and they close the wounds properly. No one can notice it, and we will try to finish this process as soon as possible. Waiting for your funeral process.
About bleeding, that is this bleeding affect whole the brain. we should mention that it is affect the area of the brain that responsible about heart and breathing, or just we will mention that all brain died.
Okay, I will explain to you. Wherever the bleeding is there, you cannot assume that did it reach to the brainstem or no. But let's talk in general. Any bleeding in the brain, particularly the massive one, will lead to brain edema, right? And the brain edema will compress over the whole brain tissue, and this compression might lead to the herniation. Whenever the herniation happens, knows that you have to know that
Brainstem will
brainstem
affect.
already damaged. Exactly, yes.
Mhm.
So this is the way. If you want to explain in details, but no need to go further.
He
This is
can said how you know about that. We have
we
a
have,
specific test
yes,
and the
we have
specific images we
exactly.
did,
We have done a lot of tests to confirm this. We are
and the
not
two consultants
disclosing
make
exactly.
sure about that. Yeah.
Yeah, we are not disclosing this news unless we are 100% sure about it. It's a
Mhm.
decision of life. We will end this patient life, so we
What
cannot.
we shouldn't mention already the test or something that
No
we
need.
already know.
No need. No need.
Okay.
He is not a medical
So we
field.
can mention also if we removing these machines, his heart will not pump
Okay. Yes.
by his
Can
own.
be. Yeah.
Mhm.
Can be. That's why if you explain it earlier that these centers in this area are responsible for most of the important function in the body, including the heartbeat, the breathing. If these
Mhm.
areas or centers damaged or has been damaged, so the heart will be not pumping again, the breathing will not be provided again by the patient. He needs to be connected to the machine. Once we disconnect, so he will declare as dead. Why? Because his breathing will stop, his heart also will stop. Clear? Okay. Dr. Mahi, you ready now?
Yes, sir. Okay.
Okay. Let's, let's start. Here you go. Yes, you can start, Dr. Mahi.
Hello, I'm Dr. Ismail. I'm senior house officer of duty now. Am I talking to Mr. Brad and you are
Yes,
65?
doctor.
You are 55 years old?
I'm 45.
Okay. Welcome, Mr. Brad.
Hello, doctor.
Today we will discuss your health issue and I will address your concern. Is that okay with you?
Yes.
Do you want any one of the family members or a friend to attend our meeting for support?
Yes, my wife, please.
Okay, okay. Initially, Mr. Brad, may I ask you how much do you know about your health status?
Okay, doctor, I have this weakness. I start to have this weakness in both my legs. And it's like gradual over time, it's become more severe and become more worse during over this period of time. I'm really concerned about what's going on. So that I came here to the hospital and they did many investigations and I met the neuroconsult. They said brain doctor, and now I'm here to discuss what this investigation and what is the what I had.
What is your expectation, Mr. Brad, about this release of this investigation?
I don't know
How you
exactly.
feel?
So I can hear my body. I can hear my body that I'm weak. So I'm really afraid what's going on. I'm thinking about I having blood clot or something in my mind that's had in my brain that's had give me this weakness.
Your feeling and words are highly appreciated, Mr. Brad. But I wanted to I wanted to carry for you bad news today. I'm very sorry. The release of these investigations is not as we hope.
What's happened?
You have a disease named as motor neuron disease.
Oh my God. Okay, I didn't hear about it.
Do you want me to explain for you more details about this disease?
No. Yes, yes, doctor.
Okay. This disease, Mr. Brad, it is a known disease, and it is involved in the main nerves in the brain and in the nerve cables, causing irreversible damage, partially and progressively going on until this weakness involved in your legs and in your hands, and sometimes is still progressing to involve the main nerve cables for responsible for swallowing, for breathing, for talking. I'm sorry for this bad news, Mr. Pratt.
Okay, doctor. I can't understand what you are saying. That means my nerve cable is dying by itself, and this will continue as well.
Yes. And I'm sorry to tell you, in this disease is progressive and it causing weakness of the legs to the degree that the patient cannot walk. And also this weakness can involve the hands and the arms to the degree that the patient cannot move his arms as well.
Oh my gosh. So
And
this is a very dangerous one. Is it like a stroke? If there is the rehabilitation, if I enter rehabilitation, or if there is anything to help this disease, it sounds really scary.
I highly appreciate your feeling, and I can imagine how much these news are very horrible for everyone. And be sure that we will form a medical team, including the nerve doctor, occupational health worker, and physiotherapist, and a specialized nurse, and all the team will take care of you, and we will give you the proper management to make you as we can to cope with your daily activity.
So how can they help me? If there is no treatment, is this team help to treat me?
I'm very sorry, Mr. Pratt. Until now, there is no treatment for this disease, and it is not curable disease. I'm very sorry, Mr. Pratt.
Oh my gosh, this is really hard to understand. I never suspect this at all. I suspect like stroke, something like that, and I suspect this can be helped by physiotherapy or anything like that, but I never suspect that they have a disease like this. What causing this type of disease, doctor? What's causing this type of disease? Why me?
I'm very sorry. I appreciate your feeling, Mr. Pratt, and I can imagine how much are this news very bad for everyone in your shoes. But this is the nature of this disease, and it is unknown also, this disease, how it come, and it involve which cables of the nerves. I wanted to tell you, Mr. Brad, also, in this disease, not only involves the limbs, but also it can involve the vital function of the body, such as difficulty swallowing and difficulty to talking, difficulty to breathing. And the team will interfere at that time to insert to you some help for feeding, such as name as big tube, a tube directed to the stomach to help feeding. And if also breathing become failed and shortage of the lung function at that time, we will connect you to the breathing machine. How this? What's your opinion regarding this?
It's really afraiding me. Can you tell me, doctor, I can pass this to my children?
Actually, this disease is not known for us, and I will ask my senior for this concern if it is pathing to the kids or no. Um, but I wanted to tell you, Mr. Brad, that we will give you the more and more care for your condition and also the proper management to keep you as we can near to the normal life. Okay?
How can I have a near normal life and disease sound like progressing one and it kill me at the end?
Yes, your concern is valid, Mr. Brad, but
2 minutes
we
left.
wanted I mean, by feeding, by breathing like this, we will try to connect you to the breathing machine if there is any shortage of the muscles responsible for the breathing, like that.
What's
We
the
try to,
benefit for my life if I cannot do anything, even just feeding myself, or I can't breathe by myself? What is the benefit for my life?
yes, I appreciate you. Your concern is highly valid and appreciated, Mr. Pratt. I wanted to tell you, Mr. Pratt, do you have any living wishes?
I never think about it. I normally live normal life. I never think about it at all.
If you lose your capacity, uh, one person close to you can take the decision on behalf of you.
I never think about it at all. I'm always the ride of my journey, and I'm ride of my life. I never put anyone to talk of me or about me. I never think about it, doctor. I never think about it.
For the second time, Mr. Brad, I highly appreciate your feeling, really, and I'm very sorry for what happened to you. And I can imagine how much this news today is very horrible for you. But be sure that all the team will take care of you, and we will give you the management, the proper management of and the plan of management. Okay.
Okay, doctor.
Do you
Thanks.
want at moment? Do you want any help, any social support, any?
I don't know. At the moment, I'm really shocked. I can't even think about anything at the moment. But I know that at a point I will need help because absolutely my life will be affected by this disease.
We will involve with the occupational health worker and the social worker for this, and the team also will care for that issue. Don't worry for this. We will help you all the time, and we will keep you under follow-up regularly, even at your home. Okay?
Okay, thank you, doctor.
Okay. Perfect, Dr. Mahi. ما شاء الله perfect.
صحيح والله أنا ما كنتش عارف أي حاجة.
No. You did it in perfect way for me. You can take the full mark if you added the job. This is the only point. If you add, you can get the full mark. But still, you can get a good mark. Dr. Maida will comment, then I will comment.
Yeah, mashallah, you did very nice. You hit all the points, and the point in this scenario, what is motor neuron disease, what is this condition is, and it is a type of disease that can be progress and unfortunate. But if you add like it, we don't know the it is progressive one, but it's the time of progression or how to combat it is long time, short time. We don't know exactly, but during your journey we always with you and the team. You said it's a team, and there is medication, by the way, Riluzole, I think,
Really
for
sorry. Yes,
for
yes,
some of them.
really.
We can add this medication. We'll give this medication, but I think I will not never. I will never mention to this man that you will live near normal life, because
Yes,
it's never be normal
agreed.
life at all.
Agreed with that. Yes.
Yeah, so he just needs support, and
You know,
thanks.
this medication only prolongs the life 3 months. This really, so
Yes,
it is
exactly. Yes.
expensive and 3 months only.
Yes.
Continue, Dr. Ahmed. Yes, Dr. Ahmed. Sorry for interruption.
No, you maintain the empathic tone. This is very important because most of us, I think, we didn't have this. The empathic tone is very important during this type of conversation, and you maintain that, and I like this. Also, you planning ahead that the advance directive, if this disease progress in a way that you can't take. I think you can touch this. If I were you, I will touch this point. It is important to let the examiner knows that you are caring that this patient. We are caring for advanced planning, but at the same time, we arrange another meeting to discuss all this again together with you regarding the advanced care planning, and if anything happened, what you want to know. If you give this patient, because it's a new disease for him, brochures or to read about this disease, brochures and websites, it can help him to understand the disease and arrange another meeting with with the MDT, with the multidisciplinary team that you are discuss with him again and again about the disease, and to know about how he can deal with this disease. And if you offer a supportive group and counselor, if you offer all this, will be very helpful. And as Dr. They said that also it's important for this man to understand what his job, and how it affects him, and most probably if you explore about if he has any hobbies, another hobbies, that maybe if he love any type of hobbies that he can do, small hobbies, I mean, he can do. We can offer even we can offer a job for him with his hobbies. You understand? If small hobbies or something like that. So this can help him to make sure that he's not depressed, and mental health team as well. But really, you did it well.
You know, the time is very short, 10 minutes about
But
introduction.
you cover all the points in the
Yes.
scenario. You cover
I
all.
agree. I agree. Thank you, Dr. Maida, for the scenario, and Dr. Muhi as well. Thank you for the practicing. And let me tell you that you're really dramatically improved in the communication way. MashaAllah. And you are in the right track. You know how to simulate, how to be acting with a lot of sympathy and empathy, which is very good. You have to know how to answer and to start the answer with appreciating and how he's feeling, how he is sharing the information. I appreciate sharing this with me. All the things. It's important to be as a professional during confirmation during the conversation. Uh, the point about the big tube, I feel it's not the time to talk about it. Particularly, it's not mentioned in the scenario. And instead of that, you can talk about the occupation issue, the job, and the driving as well. I think also it's need to be addressed in this scenario if he's driving, because he will not be able soon drive his car. Doctor, I might also add the hobbies, yes, just to know if he's interested for that. But I think he mentioned already in his scenario that he didn't expect all the things. He expects just a stroke and he will be fine. But don't mention near normal life. You are saying progressive disease, and at the same time, you said to him near normal life, which is impossible. Mortal immune disease if already started to progress, the patient will never near normal life or never live near normal life. He will be suffering of aspiration, weakness, wheelchair, bedbound, tracheostomy, ventilation. It's a lot of, it's horrible disease, as you know, particularly the types. if you can also give examples of the types earlier. We have a lot of types. Some of them are progressive, and others are more dangerous than the other. Anyway, most of them are progressive, and the end with wheelchair or disability. There is also concern by Dr. Maida why I get this disease. As you said, it's unknown, but there is theories that it might be running in family, right? It's not as genetic way, but it runs in family by any mean. So you can say yes, you might get it from the as a familiar issue.
I think no, Dr. Bassem, motor neuron have no relation in family.
Okay, we can check it. I think someone was mentioning part of or some types are related to familial issue.
Maybe the family more prone, but not
Yeah,
run.
this is my yeah.
Maybe.
This is not genetic. Yes, some families they have or they are prone to have the disease, but it's not running as a genetic way. In theoretic,
They have maybe a higher percent than general
exactly. This is what I
population.
mean. Yes, yeah, this is what I
Yes.
mean. Particularly, we have in our ICU
But
a
I
lot of
think it will not mention as a cause if he ask about the cause.
unknown.
But
It's unknown, as
yes,
Dr. Mahi said.
if he
But
ask other family or my children or
yes, this is another
yes,
point I was about
another
to talk
answer.
about.
Yes,
Yeah,
yes.
any of my children will have the disease soon. It's usually it's not running in family. However, some or your children will might have the disease in compared to normal population. Okay, there is small percentage. Otherwise, Dr. Mahi really was
I try to
impressive.
escape from. I try
Sorry.
to escape from.
Yeah, good,
I
good.
try to escape from this
By the way,
concern
I'm
because
I'm adding information
information.
just to know how to answer. But your answer was okay. You didn't make wrong in the answers, but try to address the concern. Yeah, I mean, don't skip it totally. Okay, so you can say, as you said, it's unknown. Yes, unknown is correct answer, but don't just say it and leave to another concern, or don't answer it at all. It will hurt you, or it will hurt your marks for concern. So you have to address and to answer the concern clearly. Unknown is okay. If you said some families have this disease is okay, but don't skip totally the answer. Okay.
I told her I will ask my senior, then I will
Okay, this is
update
another
you.
way to answer, yes. But no genetic way in this disease. Not autosomal dominant, not recessive, nothing. It's just running in family with unknown mechanism.
I found on searching now that this specific type of motor neuron disease, it's familial already and genetic, but it is not a higher percent. It is like 1 of 10 of people have genetic
Yeah,
problem.
this is what I remember. There is
So
some familial issue.
we can
Yeah,
say that some types of this disease
running in family.
run in family. Yes.
Yes. Thank you, Dr. Aisha, for updating immediately. Thank you.
Just I have one comment, Dr.
Yeah,
Muhi.
go ahead.
When you asking about advance directive in this scenario and the power of attorney, touch it in just a polite way because already she should just mention to him, do you before we prefer in condition like you because it shortens the life. So we prefer that you, if you have specific wishes, to write it. If you need anyone to take decision
Perfect.
for about on upon of you in critical situation when you are
Mm.
not aware or you can't take the decision. We advise always patient to decide that early. So not about asking, do you have, because
Exactly. Yes.
already he still now he shocked about this. So just in a sensitive way, we advise you because in situation like you, I'm sorry to tell that this it shortens the life. So usually in a patient like you, we advise to write some notes about his wishes
Perfect.
or to also mention anyone he can take decision if you are not aware or unable to take decision.
Perfect. Yeah, this is a good idea. Particularly, It's not in the past. No one expect, particularly this patient. So it's
Yes.
nothing to be discussed as it already done. No, in the future, as you can prepare the patient in this way, as your disease is progressive, what you prefer about your medical decision in the future? Do you prefer something to be carried on for you? Do you want someone to take a decision on behalf of you if you're
Yes,
sorry?
like that.
Yes, and so as an in future issue, not in the past, because he told you I was okay, everything was okay, I was enjoying my life, and so on. Thank
Few
No, no,
you.
sir.
point also,
Yeah,
when
Okay.
Dr. Mayada said to you how I'll live normal life.
Yes,
You ignore this. You ignore this
how
question.
ازاي ده ما حصلش.
yeah,
You
because he
mention
mentioned
after
wrong.
that advanced
No, no,
directly. Just said to her, I'm sorry. Just I mean that if even if you mistaking by some sentence and the patient reply like that, you can. I'm sorry. I mean that we will beside you to make you comfortable, and we will support
yeah,
you to have an easy life in these days.
exactly.
Yeah.
Yes. So
You
you
know,
mentioned it
I
wrongly.
did. I did not prepare any sentence. It come spontaneously like this. I know
Yes,
that
yes, I know. Just if you are also
Yeah,
now,
take
we
care.
will mention to you, you will take care if you even making some sentence by mistake in exam, try to make sorry or edit it
Correct it.
so they
Mm.
correct it. Yes, so you can because everyone, even in normal life, you can your tongue can say something you are not mean. Yeah.
Yeah,
Mm.
we have mistake everywhere and every time, but to correct the mistake if you already did this mistake. So as Dr. Maida said to you, Doctor, how can I live normal life with these all suffering? Oh, I'm so sorry about that. I mean, we will try our best not to suffer more. We will support you in this journey. We will try to make you supported as much as we can, but never ever she will be near normal life.
But
Or
really, the scenario is perfect. The way you are talking,
yeah,
the confidence and the reassurance, the
exactly.
empathy, all
Yes,
this is perfect, really.
yes. Any question, Dr. Mahi? I heard you talking. Sorry.
No, 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 sir. Thank you, sir.
Yeah. Again, it's really amazing performance. Keep on the same track. Don't frustrate by another scenario. You are doing well. You have to. You have the way, and you have the highlights. How to talk about any scenario. The skeleton, the scheme. Keep going and never give up, Dr. Mahi. Okay.
Yes, yes. Thank you, sir. Thank you.
Okay, most welcome. Any question by others? Any comments? Any suggestion? Okay, Dr. Ihda, you share something, but we cannot open it. It's just black page. I don't know what is it. If you can share it again, or you share it in the WhatsApp group. Dr. Maida, you want to add anything?
It's okay. I think he did very well.
Yeah, about the discussed point by Dr. Aisha, you want to add anything? You want to comment on it? Or even my comments about driving? You want to say anything about it?
No, not to add anything.
Okay.
Yeah, we need to ask about driving in this patient. Yeah.
Yes, okay. So it's clear for all now? Motor neuron disease as counseling. It's one of the best session in the communication scenario, really. You did well, both of you, Dr. Maida and Dr. Nohi. I like the way both of you did today, the performance. If no question, we can end the session. Thank you everyone for the attendance, and thank you for the practice, Dr. Mahi and Dr. Maida. See you tomorrow with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
So,